How is the effort right now to vaccinate staff at Eisenhower?
I think it's going well. I think they've done a really good job of streamlining it. The issue is making sure that everybody participates. And I just had my second dose today, and I look okay, don't I?
I think you look good.
There are some local reactions, but in general, it's a very safe vaccine from all intents and purposes. And when you have the opportunity to get it, we're encouraging everybody. We've had good results in terms of our group and the hospital in general. There are people getting it. We've had a lot of people get through their second dose already, and we're hopeful that'll protect our staff so that they can carry on. That's our goal.
Yeah, I'm curious, has the hospital dealt with staff refusing to take the vaccine like in some other areas of the county? And if so, approximately how many?
I'm not familiar with the exact number. There's a small number that for whatever reason don't take the vaccine. Some of it has to do with medical issues that they're concerned about. Some have had COVID and they feel like they don't want to repeat the test, although that is recommended by the CDC. And then some, for whatever reason, have vaccination issues. But that's not a majority by any stretch of the imagination. And we're working with everybody to encourage them that this is important.
Has oxygen supply become an issue for the hospital at this point?
Right now, we've dealt with the potential of it lowering. We had an episode a few weeks ago where there was, we realized that the oxygen consumption was significant, and our facilities, along with our respiratory therapy department, did a yeoman's work in reconfiguring how oxygen's delivered, and we've been able to supply the needed oxygen to every patient that needs it. And we're looking at our usage as well in terms of patients that may have been put on oxygen that really didn't need it, that are maybe not COVID patients. And so we're looking at stewardship as well, but I think we've got it pretty solidified. It's really an amazing, unexpected turn of events to think that oxygen could be in short supply, but we've been able to deal with that challenge as well.
Before we let you go, Dr. Kontaxis, is there a message that you would like to share with our viewers?
Well, I think if people would just be patient and protect themselves and others, I would be very grateful, because I don't want to see the consequences of significant COVID-19 infections. And I want people to know that we are a safe place to come if you need help, both for COVID-related symptoms and non-COVID-related symptoms. My concern is people are afraid to come to the emergency department and they wait too long. We've been able to separate out patients very well. Our staff is here. We want to care for you. We want to do what's right for each and every person in our community. Again, I just want you to know that if you're patient, I think we can get through this all together as a community.
All right. Dr. Kontaxis, we appreciate your time. Thanks for joining us.
Thanks, Peter.